Okay, so what we will look, we have just example. You remember we put yesterday this ruler and that it start in the 1.3. Mostly we'll say at 1 o'clock. We'll say at 1 o'clock, yeah. It starts in 1 o'clock. So what time do you have now in your place?
Quarter after 11, 18 minutes past 11.
Yeah, 11:18.
Okay, 11, we'll say 11:20. So we have our patient at 11:20. So what we can see here, we will look at 11, and 11, we'll say more or less 11:10, some period starts, isn't it, in our ruler? We'll say it will be 11:08. So we are in some period. So if it's the we have the female patient here, and she now will be in the as we start from the yang, she will be in the yin cycle now. Female patient, yin cycle. So what we will do, we will take, if we have 11:20, so we will just put in our graph here, we will do the one graph. We will just put the when patient came, and we will put like these three lines. We actually will start, yes, to treat better from the, so 11:20 we will put now, because usually it takes, we'll say, to check the poles, just maybe 3, maximum 4 or 5 minutes to organize everything. So 11:20, this cycle lasts 28 minutes, as we were talking, so it will be 11:48, and the next cycle will last again 28 minutes, so it will be 12:16. So easy way is just from the first one you take off 4 minutes, it will be 12:16. So once you do just in the clinic, as I put it straight away, yes, just very shortcut to.
Can we go back to what you said? You said she's in a yin cycle at 11:20.
Yeah.
You're talking about which
here because the in midday all the women start from the yang, from the yang cycle, which
okay.
So once we look here, 11. Sorry. It's sorry. We are at 11:10. Exactly, we're at 11:10.
10, yeah.
11:10. This cycle started at 11:10, not 11:20. Yes, 11:10. So 11:38 and 12:06. Yeah, correct. We're here on the ruler. So it is how the space rules us. So what is happening? So in this moment, at 11:10, it is her 11:10. It is her yin cycle. So the yin is increasing till 11:36, and after that yin will be decreasing till 12:06. We'll say opposite of that, yang from 11:10 will be decreasing. I use the red marker, and from 11:38 it will be yang cycle. It will be So we have the yin cycle, yin is increasing, and after that 11:38, the same what is our ruler will show us, it will be actually yang cycle for our patient. So each cycle we know is 28 minutes. Half of this cycle, 14 minutes more or less, 14 minutes and a half, so it is 11:24, and here 11:52. So it is these cuts how we have, because during these cuts the qi will be moving from one side to another side. So now we are actually in the one cut where the qi will start to move to the second cut. So what we need to do, our patient is now, we are here because now it's 11:24 more or less. So patient, we took the poles, we made the graph, and we will start from here, 11:24. So what we see here is the yin is increasing. It is the second cut of the cycle of our yin cycle. We just divide each cut in half. So do you remember that here it was the Rong? Rong was on the left arm, and right leg. It was the Rong, and the Wei was on the right arm and the left leg. So here it changed to the opposite. Rong will be on the right arm and the left leg, and the Wei will be opposite, left arm and the right leg. So this one key is enough to actually tune everything to the way it's supposed to be.
You mean the 14 minutes?
14 minutes is enough, yeah. 14 minutes is
It
enough.
has to start at exactly 24 minutes?
No, it's not necessary. If you will start even 5 minutes later, it will exactly by 11:38 this cycle will finish, and if you have 5 minutes, or sometimes you have 3 minutes, it will do this job. Not necessary 14 minutes. So again, to be reasonable, we do everything very, we'll say we have the some 1 minute forward backwards. We use it on practice, so it's not necessary to be exact. So what also we were talking is that now the energy which do the treatment for this patient in this moment, it will be yang, because from the 12 midnight till the 12 midday it will be yang victory, the celestial yang. It is actually treating celestial So what we can't treat with the, we can't, so it is actually also may explain why sometimes, you know, the people do the stimulation, sedation, it doesn't really work, because we have the different kind of energy, different hours. So now we have the yang. So what
Igor, I'm trying to remember from yesterday, in a man, yang victory.
it will be from 12 midday till 12 midnight. So opposite.
Yeah.
Yes, everything will be opposite to the female.
So we know it's a yang period because she's female.
Yes.
And it's after solar noon.
Yes, and we check her Tsunko and we see that she's really female.
Mm-hmm. Okay.
So really what we can see now is that we have the energy yang. What energy yang can do? Yang can actually, we have here this our pulse map. What it can do, it can actually do something with increase yang and decrease yin. It's what the energy yang does. What is good with this celestial, with this using this energy, it actually will not harm anything. It will not overfill and it will not over empty. It will actually do the job till the line. If it's under the line, it will not work. So you shouldn't be worried that it will, you do something, some harm or anything, because we don't do any stimulation, we don't do any sedation. We just pull this energy towards the line, from here to here. That's it. So what we can do, we have here, for example, liver in excess. So what we will do with the, I will use the black. So we will do on the treatment on the left leg, it's always the wrong. We see here is the wrong. We will treat the wrong first. So for example, liver is in excess. As we were talking, is excess of yin, deficiency of yang. So what we will do, we can actually puncture liver meridian. What we can do, we can puncture it on the, how we have here the earth, if you like. So we will use the left leg, liver meridian. So, but the best, if you can just in the liver meridian put the one needle on the foot, one needle is between the ankle and the knee, one in the thigh area, and one in the stomach. We treat actually meridian, because all these, we should remember that all these 5 movements, it start much later in acupuncture. So you just put some needles in the liver meridian, few needles in the liver meridian. And we have also kidney in excess. We can put in the kidney meridian.
Igor, can I stop for a second? You said something about liver was at the earth level. That does not enter in here now.
Liver, if you like, you can put it on the liver earth point. You can do it. It also works. But again, just as we treat the in reality it's later, these 5 movements they start to use, you see these meridians only under the arm, under the elbow and under the legs, because they actually could not touch person and remove clothes from somebody, and even to see the torso, it was wrong. It start later, like Confucian time. But before that, they were treating just meridian. So we will treat just meridian. If you like, you can put only one needle. But doing that, what we do, it will do the job in one K. Everything just, again, we were just talking about the principles, and in reality different practitioner can use different methods. Important that principle is working. And the same we will do with the kidney on the left leg. We just puncture some points, if you like, close in the foot, and in the shin area, in the thigh, and in the stomach, if you like, in the chest. Yes, so it will, because what we do, we make react entire meridian. So it's what we can do. Again, we don't need, now we will do in all points, we will do in all meridians which are affected, but we don't need to do that. Today I will explain only for the sake how you can do when you choose any meridian. Once you will put it only for example, for the liver or for the heart, they will start to go to its place. And how heart can go to its place? Moving lung down, because you remember that totally in this circle it should be 10. So one increasing, other should to decrease. So in reality, now we will be talking about the example for each meridian, but in reality you don't need. You can do just few, as many as you can. You don't need actually to think, okay, we will need to use too many needles. Not really. Just using one or couple of meridians, it will do its job perfectly well. So what we have here, we have these meridians, the yin meridians. What we see here, that we can also use it's what we use here, we were using here Rong Qi, and it always was only in these yin meridians over the leg. There is not anything we can use on the arm, because it's only deficient or only excessive wrong is only in the leg meridians. But on the arm we have yin deficient but wei excessive. So what we can do, we can treat now the long wei. So what we can do, we can actually, long meridian is the on the left arm, we will use long. In the left arm we use also heart meridian, and we can use, yes, that's it. And the right leg we will use pancreas meridian, spleen. Again, what we need to do, we need to, in the same way, you can put the needles, but very superficially, just under the skin, because we treat the wei here. So just tip of the needle, just needles mostly hanging on the skin.
How deep did you go with treating the wrong meridians first?
Like normally you will put them.
So a half sun, one sun, something like
Yeah,
that.
you just put it that it is yes, it's a firm in the skin. Again, we treat the meridian. So yes, it's important that it stay quite deep enough, not necessary not till the bone or till the muscle, so it stay vertically. And other one just hang. If you like, you can put it under the skin, but yes, it should be very superficial. So here we treat the Wei. What we doing that, we'll say if we will use some liver meridian and for example some Wei for the lung meridian, it will be not necessary to do all this, to use all these 100 needles on everybody. It will be already enough to put everything on the line, because we do not treat anything, we actually only balance, we tune up. Here also what we can use, again, it's not necessary, but we will just an example. So we have the Yang meridian. Which meridians we can use here, which are deficient? Yes, just tell me so you can we can put here.
Large intestine.
Okay, yes, so here in the we will use, if we use the left leg, we will use right arm, isn't it? We will use right arm. Yes, so we will use exactly, we will use large intestine. What more we can use? Small intestine, yeah.
Shall we use stomach also?
Yes, we can use stomach. Yes, we just, again, for the sake of the example, we can use on the left leg, we can use the stomach. Yes, it's perfectly well. And we have here the Yang excessive. So Wei is, we have the Wei deficient, and we still have the Yang energy, which we can use on our left arm and the right leg. Which meridian? So we can only use the right leg. Yes, it will be so which we have in excessive, Yang excess, and Wei deficient.
So the deficient on the right leg, it will be gallbladder and urinary bladder,
Yes,
right?
yeah, easy. Gallbladder, urinary bladder. Again, we don't think a second. Pulse shows
Those are the excess.
of the wrong, but deficiency of Wei. Yeah.
So on the pulse chart, all of these indicators refer to the wrong energy. So when we say excess deficient, we're referring to the wrong energy when we made the pulse chart.
Sounds right? What Peter is saying, that what we did, lung deficiency, heart deficiency, spleen deficiency, it's all about wrong.
Yes, it's only wrong. Yes, pulse shows only wrong. Pulse can't show any in
The same
on it.
large intestine was wrong deficient.
Yes.
Okay, I didn't understand that yesterday.
It's a good show. That's why I got confused too. That's what I was saying about. Thank you for clarifying.
So the right leg we can treat the gallbladder and bladder.
Yes, please.
Yes, so gallbladder and urinary bladder we only put very superficially.
What about spleen?
Yes.
Very superficial.
Yes, spleen, yes, what it was. Yeah, we also, yes, in the right leg. In the right leg we use the spleen, yeah.
We do that deep.
No, right,
It's excess.
right, yes, spleen was the yin, yin deficient, yes, so yin deficient, yang in, Wei was yin deficient, yes, Wei was in excess, Wei of the yin meridian in excess, so we decrease it with yang energy. Do you remember that? Yes, we have the liver and kidney excessive. We were putting the wrong points.
Mhm.
The spleen, lung, heart, they were yin deficient because wrong way of the yin meridians is in excess. It is the yin meridian, so we just with this yang, celestial yang, we just cool it down. So at 11:38, even we would have the procedure only for 5, even for 3 minutes, everything actually will normalize. We don't need to do another chart to check it. What we need to see, for example, the simple, like the small intestine is weaker than the gallbladder, isn't it? Large intestine is weaker than gallbladder in our chart, isn't it?
This is where we get confused about what's going up and what's going down.
Yes. So yes, in our charts we see that yes, the large intestine supposed to be 4 and gallbladder supposed to be 1. So large intestine should be stronger. But in our chart, which we had, large intestine is weaker than gallbladder.
Yeah. Okay.
So everything, we don't need to draw the chart again. We just take the pulse with 2 hands and we'll see large intestine and gallbladder. And we will see actually large intestine become stronger because it starts to move up and gallbladder will move down. If you like the same, you can try, for example, like the stomach and the gallbladder with the 2 fingers, just to see, and you will see actually everything normalize. You don't need to draw everything. If, for example, for some reason it didn't happen, you can do the same treatment for another one, but we don't, we'll say, mostly it's something should, I don't know, you did some mistake and did opposite legs, but so you just leave it as it is. But in reality everything will happen before this period, another period starts. So that's it. So now yin period finished, 11:38, and the yang period start. So our patient came to us with some condition, I think. So we don't know, we'll say, people usually will say what it is. Maybe it's some pain, or maybe, I don't know, we will say it is the digestive problem, because it was some patient came and said, oh, I have maybe I had some intoxication, I have something with my stomach. So what we will do, we will remove all these needles, we don't need them anymore, and now we will treat actually the particular area. So what we will do,
Just a quick question, Igor. Will you try to keep needles up to the end of the period of those periods? Or you said 6 minutes is enough? Or what?
yes, whatever, yes. No,
Just
6, no, 6, no, the 6 seconds, 6 seconds,
seconds,
yes,
okay.
6 seconds,
When?
it's now we are coming for the treatment. Now we are only tuning, but we don't do the treatment. The 6 seconds, it's to actually to bring energy, we'll say to synchronize you with the space. So what we do now, we will, somebody comes, will say everything is normalized, everything is perfectly well. Now we will treat digestive area. So we will say, patient, okay, just open your stomach area, and we will treat the digestive area. So what we have here the patient, and here is the stomach area. So what we need to do, now we have our wrong energy on the left arm, the same like the first, left arm and the right leg, absolutely the same, will be here, left arm, right leg, and Wei will be on the right arm. So what we will do, we will treat digestive issue. And how we will treat it, we just will put, for example, for this digestive, we will treat the only stomach area. Everything is balanced. We will treat only stomach area. We will send energy, all energy over there. So what we will have here the which meridian we have is the only wrong energy goes through the right leg. The right leg. Here we have the right leg. Patient is laying. So what we will do, we can put some needles on the stomach meridian. We can put some, just stomach meridian, just like the picture. Some kidney meridian, we can put some in the what's the name, the spleen meridian. Yeah. So whatever you like, you put them again, the deep vertically, you put them, and horizontally you put very superficially the same on the other side. Yeah. So it is very easy. And now we actually, because all the strings of our instrument start to vibrate and receive energy as they supposed to do, we will start to treat. Now we have this in these 14 minutes. We have the 3 spaces. You remember that it starts the yang. It starts with the Shao Yang, Shao Yang. It continues to the Yang Min, and continues to the Tai Yang. So these meridians, they will be antenna, the reception, to send all energy over there. We tuned them, and now this energy is ready to flash, to go directly over there. So what we will do, we will take the needle, and we will treat with the needle Shao Yang first, in this time, in the first more or less 5 minutes. So we will take the needle, and we will we'll say like the only 6 seconds is enough. So we will take, and it will start somewhere on the arm, just 6 seconds. We will treat it through the arm, shoulder, go to the neck, and from the neck opposite side we will treat gallbladder meridian. We will just needle touch, touch, touch. Of course it penetrates a little bit, 1 millimeter maybe in the skin.
Did you use the same needle? Or you?
Yes, you just take needle like that, compress, push, because actually it opens the skin, and only with the tip it will touch the skin.
Can we still use one?
Yeah, I use one.
Yeah.
I'm not just pediatrician, but I'm like it.
Yeah, so if you like, some people just use the, in the guide tube, they just keep it in the guide tube, they put the guide tube and just press a little bit. Again, you don't need actually puncture in, you just press it with the guide tube, especially with the children. Yes, so they even don't know that we do acupuncture. So we did it in the first 5 minutes. If, for example, these 5 minutes gone, because we were putting these needles, so we use this one, because we don't treat it, we just use it like antenna. We take our antenna and we connect it to antenna of the patient. So we use this double Qi to send to the treat. So after that we will use the Yang Min. So again, we just the same way we will treat on the left arm and the right leg. We will treat the Yang Min meridian. So we will treat it through the arm to the neck, and from the neck down through the stomach. You already have something, so you can only touch the needle and go to the leg. So doing it like antenna. And what you can do, we can also treat the way instantly, because actually it will take just maybe a couple of minutes to treat everything. And for that is the best to use this silver, because silver coin or silver whatever scraper. So what you need to do, just rub it like I was showing, just rub, and it will produce the red line. So when it produce the red line, you just go go further. It's actually we activate Wei. So we use and the Rong and the Wei. So again, first it was the Rong and Wei in the Shaoyang and the Rong and Wei in the Yang Min. So side of Shaoyang and side of the Rong and side of the Wei. And when it's go to the end, if we even, for example, something happen here, one is enough just to use the Tai Yang. So this everything, we don't treat this meridian, we use them like the receptor. So Tai Yang, and we will use these through the small intestine, again the touching with the needle, different spots on our left arm and our right leg. So, and opposite arm and opposite leg we just rub with the silver coin, and you will be surprised at how many patients you will find actually have the mercury, lead, aluminium in the arms, excess of the whatever metals. And often these metals, this excess, produce that people have some chronic issue, and because the meridians, they just can't work properly. And with the silver coin you will find how actually will be removed. I will show you just when we finish with this treatment, this video, because now I know how to, you can see it on the Skype better. And once you notice that somebody has this black line, next time you will do exactly the treatment over there, and you will see it become less, because often it affect very much. I found that it affect very much when we have some metals in our meridian. It just make real treatment impossible. So you will need to remove it, and it will be going away. And showing it to the patient, they are very happy to come, because they actually see how this heavy metal or whatever metal is decreasing in the body. Okay, so what we did,
Igor, one question. When the second step, when you treated the abdomen, in choosing the right leg, for instance, even if you're just going by the meridian of the right leg, so even if it goes above the navel,
yes,
it's in the upper body, you still stay on the right side?
Yes. It's because it's the leg with the wrong meridian.
Okay.
Yeah. So what, after these 14 minutes passed, what we do again, we do absolutely the same treatment. So what we will do, these deep needles, we will pull it a little bit up. We can leave them superficially, or we can insert them under the skin, and
deep on the other side.
yes, and the deep on another side. Yes. So it will be even the easier, much faster, quicker. And here what we have again, start absolutely the same, the Shaoyang, Yang Min, and Tai Yang. because what happens that it was first on the one side wrong, and after that it should wrong do the same in the other side. The same like the it was these meridians, they were like that in the way on the one side, and after that they will go on the way on the other side. So it will be full cycle between two. So what we will do again with the using now Rong and Wei, like here, like on the second key, because it's the second key of this, second cut of this period, of the Yang period. So now we will use for the Rong right arm and the left leg as we did, and for the Wei left arm and the right leg. So again we will be using like antenna, first Shao Yang on the right arm and the left leg, and the Wei we will use the opposite, left arm and the right leg, scraping, and after that we will use the Yang Min on the left leg and the right arm, puncturing, and with the scraper, silver scraper, we will use on the left leg and the left arm Yang Min, and we will finish with the Tai Yang. So it actually, if you like, you can use only during, if you feel some people have the few patients, so you can use just only for the one of these periods, just activate, because it works like the antenna reception.
And Igor, you've chosen to treat the yang meridians, the 3 yang meridians, because it's a yang period.
No, it's not only yang. What mean that we treat and yang, in the stomach we put all the meridians, and the pancreas, everything. But what is working like antenna is in the yang period, why we've had to find the yang or yin period. It's because it is actually now receiving energy, yang meridians which are receiving energy.
Because it's a yang period.
Yang period, yeah.
It's 1 o'clock, right? Till this full moon, right?
When you say it's a yang period, you
No, it doesn't matter. Yes, it will be yang. It's yang energy during yang period. Before it was the yang energy during the yin period. Now yang energy during the yang period. If it would be, for example, yin period, we will do the same on the stomach. The same on the stomach.
It's these yang and yin periods. It's not the half days.
Yes. Because yes, only this. So by 12:06, yang period is finishing, and start the yin period. So if it would be yin period, we would start to use here with the Tai Yin, the Tai Yin, Shao Yin, Zhu Yin, Tai Yin, Shao Yin, Zhu Yin. And actually, yes, in the 7th difficulty, which we are talking over there, it's explained it. How does it do? Because yes, just if we will check through the poles during the each care, we will see how it is increasing, yin decreasing, yang increasing, yang decreasing.
And when you do this meridians, Tai Yang, Shao Yang, Yang Min, Tai Yang, is it like you put needles sequentially and remove them, or you can put all of them and leave them there?
No, you don't what by these meridians
Yeah.
you don't put the needle, you just touch.
You touch,
Yeah,
just
yeah, yeah,
touch.
yeah, yeah. Doesn't matter. Just it's better to do it as more on the meridian as you can. Yes, you just.
And that sequence, we just do Shaoyan first,
No,
and
no, doesn't matter. Yes, but yes, sequence only. This is because the first minutes, and after that, and it's like the activity.
So from less to more, is this right?
Yes, from smallest to the largest, and the yin periods it's opposite, from the largest to the smallest.
And you use approximately how many needles on each of the distal meridians during this 5-minute sections?
Yes, how many needles?
Yeah, how many points do you puncture?
Yes, usually I try as many as I can during the meridian, because it's just we help different part of the meridian activate.
So maybe 3 or 4, something like that, or more.
Yes, I try to do more. If for example, I will try to do definitely some on the foot, some on the shin area, some on the hip, some on the stomach. So because it's only just for the few seconds, you just keep it for the few seconds, and just keep it for the few seconds. But yes, as more you can activate, more area you can activate of this antenna, is better. So yes, what
If it's a yin period and you're treating the Tai Yin, Shao Yin, Shui Yin
yes.
meridians, those needles go deeper?
No.
Just
Just the same. You just activate the antenna. Activate the antenna. It's enough just to touch. You see that even in the 9 needles of the from the Ling Shu, and if you look in the photos of these 9 needles, you will see some of them, they just like that. This is the needle, because it's not need actually puncture. Just keep it like that. What you do, you actually connect patient with your body. And if we will take, for example, what I was doing, for this case I had to make the earthening for the bed. So with the earthening for the bed, you can measure it. I take the tester, electric tester, and I was measuring the voltage, my voltage and of the patient voltage, which is easy to do. And once you have, for example, this voltage, it's maybe measured for normal people, it's the microvolts. Once you connect somebody, this voltage increases, and it increases absolutely the same amount how the different people, which voltage they have. So it's actually increases. And if you do some movement, if you do some exercises, your voltage increases even more, your antenna increases, because your vessels, as we were talking before, it's our vessel is antenna. Reception start to increase dramatically. And if you will look, for example, like if I do the treatment for the pregnant woman, their voltage is actually much more higher than the normal person, because we measure them in the, not in the micro, in the millivolts, because they have the baby, which has extra vessels, and they have the placenta, which is the body of the vessels. So it's just pure huge antenna which produce a huge reception. So yes, the we can actually measure that, and it's not necessary often to touch with the needle, puncture, just only touching with the needle. It's just the increase is the better conduction. So it's why we use the, for example, on the way, the silver coin, because it's just better conduction. And what once we rub way, it open the vessels, it increase the conduction. So it's why we use in the Rong and in the Wei. So, and yes, and we can actually measure it with electric testers. It's not only just like we'll say some belief, but in reality we can check. In reality, yes, we need just only even touching. Our two antennas of the patient and the practitioner come together, and we actually receive much more energy. And for that, yes, we use these meridians, which actually each moment they are more active to this reception. So once we did it, we remove the needles from the stomach, and what we will do, we will just take this silver coin, and we just rub the stomach to open the vessels, area become red. So we just increase the not only Rong but also Wei circulation, and that's it. Finish. The treatment is finished. So for example, if somebody comes here with this patient came here, for example, with knee pain, we'll say knee pain, her right knee is painful. So what we will do, we will only put on the right, it will be only, we'll say, needles on the here on the Rong, because only on the right leg it will be Rong. So we just put the needles on her knee, and after that, next care, we will be putting this needle superficially, and after that, when we finish treatment, we remove the needles, and with this silver coin we will rub very, very hard, so all her knee will become red. What these people always notice, that straight away after the treatment, doesn't matter what pain is, knee pain, elbow pain, frozen shoulder, instantly they have relief. You will notice that instantly people feel better. So the pulse is normalized, and the symptoms they definitely will improve.
So Igor, some patients are very sensitive in an area where they have pain. They don't like to be touched, or it's painful to touch them there. You still rub hard with the silver.
For that case, you can use moxa. It's what the moxa to increase. But with the moxa, instead of the it's very long to warm up. So easier to use it with the silver coin to work with the Wei. If not, you can use the moxa, and I think that moxa was actually used very much, because in that time a lot of the skin diseases were between people, so they couldn't just rub with some silver thing. They were more preferably using the moxa, but it's much longer time. But if somebody can't, you feel that they can't be touched, but I would say that you can try. Of course, that if it's inflamed area, you will not do so, definitely. But if you feel that, just try. And often people feel that, I know the people will say, most of the patients, they after the treatment, after we do that, they say, oh, I feel it's relief when you do that. It's soothing.
If it's inflamed, you also don't use moxa, or you do?
Okay, again, you will use it if it's inflamed. You use I use the moxa, but with the moxa we do not heat. We just can't heat deep. We can't heat actually under the skin. Moxa it's heat only superficially because it's infrared. So we just of course we just improve the way circulation. It's nothing wrong. Of course we can't apply the heat pack under, because it will be heat of the contact. It will yes, affect the inflamed area, but superficially it's nothing wrong. And once you have here the needles, superficial needles, this area you can't pass. For example, when the needles here, you can't pass, for example, like the silver coin on the stomach. So instead of that, you can just do it with the moxa. If I have time, I do it with the moxa a little bit, and it helps. So, and again, when the next time patient will come, what we will see that actually the pulse definitely will be different. And yes, just every time you do your check of the pulse, and you will see how it is changing, what is happening. So yes, as we started from actually 11:24, we will finish, we'll say, in 12:20 more or less, because here we were rubbing with the silver coin. So it usually takes about, you see, first we will actually tuning, after that we treat one side, other side, and after that we just normalize the way. If you like, you can do what I do to many patients. I just rub through all the body when they come the first time to actually detox them, because in the future it will improve very much your treatment, because if the meridians, some meridians, they have the metals, and most of our meridians, they have the metals, it actually will remove them. You don't need to do it every time, but you can do the detox for the first treatment. If you like, second treatment, to rub it through all the body takes about no more than 10 minutes.